My name is Chuck Hill. I am the Provider Relations and Network Development Director for MeckLINK Behavioral Health Care. My sole responsibility this morning is to introduce our speaker, which is Lindsay Askew, who is with Program Integrity and Compliance for MeckLINK Behavioral Health Care, and he will be doing our presentation this morning. And so I'll turn it over to Lindsay.
Good morning, everyone. As Chuck mentioned, my name is Lindsay Askew. I'm the Director for Compliance and Program Integrity at MeckLINK Behavioral Health. And I've been asked to present to this group around program integrity and compliance and what a program integrity department should look like, some of the elements of those departments, and some of the issues that you'll sort of be facing as you implement your program departments, or if you have program departments already. And also, near the end of the presentation, we'll talk about what we're doing as a program integrity department, what we'll be looking at in the coming year for 2013, and share some of the experiences we've had to date. Just before we get started, if by a show of hands, you can tell me who we have in the room. Are there any program integrity officers or compliance officers in the room? Raise your hand. Finance or operations? Yeah, a little shy. Okay, no problem. And then how about clinical or utilization management? All right, thank you. Any providers, practice owners, proprietors in the audience today? Excellent, sounds good. I'm the only one on the agenda today, so we can make this interactive. You can feel free to stop me as I go through and ask questions. Should you have one, I'll do my best to answer that, as opposed to having me drone on for an hour. Let's see. Sort of the background we have here. What we have to do as an MCO, LME in North Carolina, they require us to, one, educate our employees around our expectations for compliance, program integrity, and ethical behavior, and also educate our provider networks on how to at least identify and mitigate and prevent fraud, waste, and abuse. We have the expectation that our employers will follow our lead as we present those trainings and the guidelines, and we also have similar expectations for those in our provider network. In your provider contracts or in your discussions previously, you probably have heard or been aware of the requirements to have some type of program integrity efforts within your organizations. And just one thing about program integrity or compliance and compliant mitigation activities, we don't expect those efforts to eliminate compliance issues, but we certainly expect those efforts to mitigate the occurrence of those issues. Even our best efforts, while put in place, may fall short of eliminating all incidences of compliance and compliant non-ethical behavior. What is corporate compliance? It's a system of effective internal controls that promote adherence to federal laws, internal regulations, and policies and procedures, and promotes ethical behavior within your organizations. Now, some of the key words there are effective and internal. It's sort of easy to get policies and procedures. You can go online, you can hire consulting firms to come in and give you sort of canned policies and procedures that speak to regulations and legislation within the federal and the state environment. But it's important that you tailor those things, those policy procedures, to your specific organization. No one size fits all. And it's also important that that activity is baked into your operations. It's not a police activity. It's not something that's sort of oversight and annoying, if you will, but part of your everyday operations and part of your normal thinking and processes. So, effective. And it has to be internal controls, because MeckLINK may come out, or other MCOs may come out and do desk audits around your coding and billing practices. That's not an internal control, that's an external control. And if we were to find deficiencies, that's sort of the bad place to be. You should have some internal controls to help manage your operations, so perhaps you'll identify deficiencies and correct them before any external review should come and find them. Some examples of corporate compliance, or what a compliance department and program integrity department should do. It should encourage ethical ways to do business. It should be second nature within your organization. Policies and procedures, processes, training, expectations should be set that if one unethical behavior is performed, there will be consequences. Two, if you see or hear of unethical behaviors, the expectation is to report that information and not just look the other way. It'll provide structures to prevent, detect, and deter fraud, waste, and abuse. Things such as training, education, policies, procedures, hotlines, reporting opportunities to report anonymously within your organization, and should provide confidential ways to report suspected fraud and abuse. Sometimes an employer may feel uncomfortable reporting to their supervisor or reporting to anyone within the structure, so if you had a 1-800 number, anonymous email account, or some other way, suggestion box even, for folks to report anonymously, that would be setting the right tone within your organizations around ethical compliance and reporting and activities. So, what is fraud? Beyond bad, right? It's an intentional, deceptive act done for unlawful gain. Okay? There you go. Thank you, Bob. It's an intentional, deceptive act done for unlawful gain. And the issue here is intent and unlawful gain. So you have to be engaged in something where there's a effort to deliberately defraud Medicaid or the MCO. And fraud isn't just from the providers or just from the MCOs or those players as well. It could also happen in the consumer or for the recipient environment. Some of the examples of fraud could be alterations of bills or submitting false claims, claims for services that were not rendered, or claims for services that may be in excess of what was actually rendered. Duplicate billing, a lot of times that happens by mistake in earnest, not a problem there. But if it happens to a degree that's, I guess you say, outside of normal, we would have to take a strong look at that. So billing for services that have already been paid. Non-qualified practitioners billing for services. In those cases where you have a provider who's certainly authorized to provide care, but not authorized to submit a billing without the appropriate oversight. So if you were to bill for services that didn't have those appropriate oversights, that would be an example of fraud. Falsifying medical records to support either services or to support a billing claim. Unbundling or upcoding or miscoding. And from the consumer environment, if one were to get a prescription and resell those drugs, that's also an example of some fraudulent activity. And on the MCO side, if we were to inappropriately deny or delay care, that would be something that would be considered fraudulent under the statutes and regulations as well. So we certainly have things to make sure we comply with also. Are there, within the audience here, are there other examples that you may know of that we haven't mentioned here of some fraudulent activity or things that may be considered fraud, or things that you have questions about at this point? Everyone has it covered? All right. What is abuse? And it says something different up there. What's up there is an example of abuse, but abuse is the improper use of information or documentation. Abuse, different from fraud, is that the criminal intent is not there, or you can't prove criminal intent. Going back to submitting duplicate claims. If you submit duplicate claims, it could very well have been an accident, an oversight, a system error. Doesn't necessarily say there was a criminal intent behind that, just part of operations that sort of slipped through the cracks. So that would fall under the category of abuse. And these terms, in terms of legal constructs, they have significant meanings. Fraud may have one set of cure activities where abuse would have another. So they're not irrelevant. Some examples of abuse: billing for services that are not medically necessary, deliberate overcharging. If you have an evaluation and management that was 15 minutes, but it was billed for an hour. Again, could have been clerical in nature, could have been a typo in entering the codes, could have been a problem in filling out the billing sheet. Not necessarily saying it's intentional or there's criminal intent there, but if it happens in a volume that's outside of norms, it could be considered abuse of the system. And billing Medicaid for a higher fee rate than other insurance companies. If MeckLINK got a bill for $8,000 where others got a bill for $1,000, we may get our feelings hurt. So those are some of the examples of abuse that we have here. Did someone raise their hand? Scratching your face? Okay. Some of the federal laws that address fraud, waste, and abuse, there's been a lot of them in recent years, but it starts back with the False Claims Act. There's anti-kickback statutes that frown against receiving payments for referrals or being part of a pay-for-play scheme. The Health Insurance Portability and Accountability Act, which I'm sure we're all familiar with, had regulations in there beefing up the enforcement of fraud, waste, and abuse. The Deficit Reduction Act created new requirements for MCOs and providers alike that provide services to the Medicare and Medicaid environment for fraud, waste, and abuse inside their own entities. There's a whistleblower, Employee Protection Act, which pretty much, as it says, offer protections for those who choose to report what they think may be fraudulent, wasteful, or abusive activities within their organizations. And it also provides them with a monetary reward, which is a percentage of the money which is recovered. So if there's heavy activity going on within an organization, the Whistleblower Act is probably a fairly decent incentive for someone to perhaps turn that activity over to the authorities, or at least suspicion of that activity. The American Recovery and Reinvestment Act, or HITECH, actually funded the Program Integrity Office within the federal government. There's an office being funded which sort of are pushing down the regulations, requirements, and expectations through organizations like MeckLINK to provider networks and to all those involved who are consumers and payers and providers within the Medicare and Medicaid framework, requirements and expectations on how to run a program integrity office. And then lastly, the Affordable Care Act, which also added to that funding for program integrity and compliance. And I think within 2011, the Office of General Accounting within the United States government estimated that Medicaid and Medicare fraud was a $64.8 billion problem. If you listen to any speeches lately from the president or from the administration around the Affordable Care Act and savings within healthcare, reducing fraud, waste, and abuse is always a big piece of how those savings can occur. So it's a big deal for the federal government, it's a big deal for state governments, and it's a big deal for us. We talked about this a little bit, but the False Claim Act states that anyone who knowingly submits or causes another person or entity to submit false claims for funds are subject to damages plus civil monetary penalties of $5,500 to $11,000 per false claim or per occurrence. So you can see how that could add up if there were activities going on unchecked within an organization. We talked about the anti-kickback statute. We didn't talk about the penalties. One is the conviction of a felony. And there's $25,000 in fine or imprisonment for not more than 5 years. So again, there's some really serious consequences to these activities if we don't take control of our organizations. And the great thing, or the good thing about having a program integrity compliance and compliance department and program, again, it doesn't mean that things won't go wrong, but it means if things do go wrong, at least you have some footing to say, we tried to prevent it. We took efforts to make sure that we caught things before they happened. We took efforts to make sure our employees were aware of the expectations. We have an ethical environment. And we have training and policies and procedures and processes that we put in place to intend to prevent these types of activities. It's a lot better than having to say, I don't have any policies, or we haven't done training since 2009, or we haven't updated our policies and procedures in 2 years. So that's the importance and the key importance of a program and compliance department. It shows a solid effort and adherence to what's expected in the program integrity environment. The Deficit Reduction Act, some of the key points. Requires any entity that makes payments or receive payments of more than $5 million annually to provide federal false claims act education to their employees. So if you hit this threshold, this should be part of your compliance plan. It also established the CMS Medicaid Integrity Program and startup funding for years 2006, 7, and 8, and 9, and each year thereafter. And from this point on, it's funded at an amount of $75 million per year. And it also created a cash incentive for state fraud and abuse laws, and that means states get money if they have these laws on the books. It's an incentive for the state beyond ensuring that healthcare is delivered in the most efficient way possible, but also to take up this cause and to help reduce the cost of providing healthcare within the state and the federal government. So, any questions or comments so far? Any concerns or ideas? How many people like compliance? Chuckle. Okay, that's good. That's good. Do you see the importance of it? Why it matters? I'm trying to get something out of you here. Why is compliance program important? It allows providers to adopt and implement policy procedures that guard against fraud and abuse. Yeah, we talked about that. It sets you on the right footing. It sets the right tone. It creates the right environment. It provides a corporate culture of ethical behavior. And that's important because you don't want the opposite, right? You don't want a culture of unethical behavior and the things that can spring from that. One person does something wrong, looks the other way. Other person thinks maybe that's a good idea, looks the other way. Before you know it, I'm at your door. And it has a good faith effort to avoid compliance issues. And as I said before, it's always a good faith effort. It doesn't mean it won't happen. It does not mean that something may go wrong. It does not mean that as we're doing our sophisticated data mining and research and algorithms that we won't identify some pattern that creates some suspicion of some activity. But when we show up and we ask about policy and procedures, when we look at records and charting, when we talk to your employees, at least there'll be a comfort level that this may be an aberration and not something that's intentional or systemic. Okay. What should you have as part of your compliance program? Now here's a disclaimer. I'm not telling you what your compliance program should be. If something goes wrong, you can't say, well, that's what Lindsay said. But I'm going to give you some ideas of what should be inside that program and some of the things you probably should consider in setting up the program. First and foremost, written policies and procedures and standards of conduct. That articulates providers' commitment to comply with applicable laws, et cetera, et cetera. The policies and procedures should address the laws specifically that you're trying to cover within your organization. Again, you can purchase them, but it's much better to write them yourself because you live with them, you know them, and you really bake them into your organization. You should have a compliance officer. I saw a few hands went up. There's some compliance officers here today, and that's great. But you should have a focus point around these issues within your organization, someone who's going to ensure that the policies are, one, developed, implemented, kept current. And this person should be accountable to executive leadership. They should be able to have a direct line to either a board, if a board exists, and to the chief executive officer so that they don't feel oppressed if they should have to report on someone they have to report to. All right, some of the elements of a compliance program. Written standards of conduct, of course. You should have some executive oversight, either, again, a compliance officer or board, executive officers on your board, executive leadership involved in the process. There should be a code of conduct and ethics that's circulated at least annually, preferably signed, that folks have read it and understand what's expected. There should be some training and education, kind of like this one. Conflict of interest policy, a policy that encourages employers, owners alike to disclose if there's any conflict within your organizations. Is there any financial interest or family interest in some of your work activity? A conflict of interest doesn't mean that you can't work, it just means you should disclose that particular information. So should things come up, it doesn't look like things were happening in the dark or in the shadows. You should have a whistleblower policy that protects your employees from recourse if they were to inform of what they suspect to be fraudulent activity, because a lot of times, or sometimes, they may not be sure. So they may not be very comfortable in reporting what they see. But if they understood that any report made in good faith will be honored and not retaliated against. That would be helpful for the environment overall. You should have an employee handbook, something for employees to turn to when they have questions around policies, procedures, how to act and react around these issues. And there should be corrective action and disciplinary procedures. There has to be some type of response to issues found. And then auditing and monitoring, right? So you put the plan in place, you develop the policies, you develop the procedures, and you just leave it there. You can't do that. You have to take a look at it. You have to do some internal auditing and some monitoring of your activities to make sure that you're compliant with what you say you're compliant with. You know, it's one thing to not have a policy. That's pretty bad. But it's worse to have a policy that you don't follow. So you have to make sure there's training, auditing, monitoring, too. So once you develop your policy, make sure those policies are being executed as anticipated. All right. Now I know I can get some feedback on this one because there's compliance officers in the room. Some of the compliance officers' duties. Oversight of the compliance program is key. You should chair your compliance committee. The compliance committee can meet routinely. The frequency is particular to your organization. Should ensure that employees, board members, and consultants are trained. Oversee investigations that may need to occur, and maintain your compliance program records. Are there any other duties or activities that anyone may deem important or regular in your current activities and processes? I hit them all? Knocked it out the park? No? Okay. Well, these are the key ones. These are the things that you can start to build your program around, begin to formalize the position within the organization. And if you do these things, what you're doing, you're reducing your risk. You include your board and management team when developing and reviewing your compliance program. You get buy-in from all involved. You make sure that these, again, your efforts aren't oppressive to operations, because operations still need to occur. And then you still have your issues of timely billing and your issues of seeing patients and your issues of staffing appropriately and meeting budgets and all those things. So your compliance efforts and your program integrity efforts aren't meant to frustrate those other things you need to do. So you need to get buy-in from your management team. They need to be part of their operations, and they need to be included in that discussion. And then if you get buy-in, you can get your management team to set the tone and provide guidance and leadership around these issues. They won't be seen as something that they have to do, but rather something that's part of their normal business operations and part of the normal expectations of a work day. And then ensure that the board holds the executive leadership team responsible to keep all involved in monitoring. So at the very top of your organization, they should think this is important too. They should be a cheerleader for these efforts for compliance, for ethical operations, and for integrity within your operations. So benefits. Obviously, it demonstrates a good faith effort, as we talked about a couple of times. The benefit of the program is to say that we're doing good work. We're taking focused efforts to ensure that, one, we understand what's required of us, we've documented what's required of us, and we do internal auditing to make sure that we're on the right path. Another good outcome is that it may actually help prevent fraud and abuse. Your internal audits process may actually identify a systemic problem that may have been creating overcharging or undercharging or poor documentation, and you fix those things before they become an issue. It creates an ethical work environment. When people talk about it all the time, when you have committee meetings, when you have policy procedures and training and education, folks begin to understand that this is a real important issue, and it's a real expectation. It can improve on billing errors. It can avoid conflict with self-referral and anti-kickback statutes. And it can definitely reduce your exposure to fines and penalties. And that's, if you're a compliance officer, that's always the thing that we try to quantify, right? Because, one day someone's gonna say, well, why am I paying you? I haven't had a fine in 3 years. So you have to say, that's because I saved you, right? We prevented those fines. We were able to avoid bad behaviors. We were able to avoid having to defend ourselves against accusations. And those are savings within the organization. It's far different than if you have to constantly copy records and send them out and pull teams together to go through charting and defend why you bill for something. Because if you have proper procedures and proper processes, those things don't happen, and there's a savings associated with that. So if anybody asks you, why am I paying you, you can tell them, look at all this trouble and fines I saved you. No one's gone to jail in weeks. Ha, they're here. All right. I'm almost at the end though, folks. Thanks for coming. All right, so our focus, MeckLINK's focus for 2013, this is our maiden voyage within the Medicaid managed care environment for behavioral health. We started, we went live March 1st of this year. It's been a full month now. We had to develop our compliance plan for the year. And some of the things that we've done in terms of internal controls, we've implemented a fraud, waste, and abuse system. And that's not a system to conduct fraud, waste, and abuse. That's a system where a IT system, a data warehouse, if you will, where we collect all of our claims data and we do analysis on it. And we look for patterns in the data to see if there's any instances of what may be improper activity. We also have to send out, or will be sending out, monthly explanation of benefits to consumers. So those EOBs explain what services has been provided to them and gives them an opportunity to confirm or deny that they received those services. And that's when the desk audits is something that we've always done, I imagine. But we also will be doing audits at the provider organizations. Some will be because of the leads or information that we have coming into the program integrity office. We get leads from the fraud, waste, and abuse system, from our data. We also have an 800 number where we publish, and it's in the community where consumers or others, employees or employers, can report what they suspect might be fraudulent, wasteful, or abusive activity. And those things may lead us to come out to ask for certain charts and review what the charts say relative to what we have in our system. And then there's also routine desk audits. And we also check provider networks as we're required against HAS and GSA excluded provider databases. HHS, Health and Human Services, and General Service Administrations. So if providers are on either one of those lists, we're required to, one, identify that, and then to take action if their providers should be in our network. In the 30 days that we've been operational, we've learned that intensive home health services is an issue, and I'll just sort of put it that way. Sometimes there's a discrepancy between what's billed and what's documented in the records. So if you're doing intensive home services, to be sure, make sure you're documenting that appropriately. And I don't know, Elizabeth, is there any more you want to speak to that, or? Because I'm not clinical, but she probably can give you a little information as to what would be expected if we were to review the records. And the only reason we're focusing on this is because it's something that we've noticed once we've had this responsibility as an MCI.
Good morning. I'm Dr. Elizabeth Peterson-Beat. I'm the clinical director. You've seen me many times before. Just to enlarge a little bit on what Lindsay has said here, this is not just something that we've seen in Mecklenburg, but across the state there has been just an enormous upswell of children, particularly in intensive in-home services. And we, for example, have over 900 children in Mecklenburg receiving the service, so you can just extrapolate across the state. There are many, many children receiving it, and certainly many of these children should be receiving it, etc. It's an enhanced service. But as an enhanced service, we would expect that the children who are receiving it have more unusual behavioral, psychiatric profiles and need a more intensive service as well. So we would be looking for documentation that really supports that, as opposed to children who could benefit from a more routine outpatient traditional psychotherapy service as well. And also what we have seen, and I'm also getting some feedback from other clinical and medical directors around the state, is that sometimes children who are in the service and people are looking at the service, it turns out the service is really not delivered as intended in terms of the intensity, the appropriately credentialed people to do it, a team effort, etc. So that sometimes it really is not falling in line with the service definition, which is quite extensive. And if you are delivering the service, please go back and look at that to see that all those ducks are in line with that. And also, there have been occasions, not something that I can put my hands on here certainly, but sometimes parents have not been aware that children receiving the service, that it's really a psychiatric/behavioral service, that they've thought it's some kind of generic mentoring service or an after-school kind of big brother, big sister service, and that's really not what it is, and that's not the intent of the service. So those are the kinds of things that have kind of led people to pay greater attention to that, and we really want to reserve the service for the children who are in the most need of that as well. So that would be some of the background to that and why we're taking a particular look at that. Thank you, Lindsay.
Thank you. And that's what we call a hint. All right, so if you're performing these services and you're billing for these services, be certain that your documentation sort of support that billing. All right, so to recap, federal and state have a strong focus and expectations around program integrity. We have a strong expectation around program integrity and compliance. In return, providers should have a strong compliance program. And a strong compliance program, again, is particular to your organization. Multi-state, large provider, many employees. Program may be of a size and significance that fits their needs, while a smaller organization may need just a compliance officer, definitely always policies and procedures and training. So one size doesn't fit all, but what you put in place should fit your organization. There are civil and criminal penalties for violations. It's not merely a slap on the wrist or pay back the money or you're suspended for a year. It could be jail time, and it could be financial impact. You could lose access to state and federal programs. That sort of harkens back to the list I referenced earlier that the Department of Health and Human Services and the General Services Administration maintains that we are required to check against on a very routine basis. Training and education is key. Just as you came in here and signed in, If you conduct training, you should make sure that you have signatures of who attended that training, dates of when those trainings occurred, and have that information on file should you find you need to defend your position. And the most important thing, the thing that sort of brings us all here together, is that MeckLINK has an affirmative obligation to detect, prevent, and report suspected cases of fraud, waste, and abuse. I mean, we have a department that really looks at these things because it's required of us. So it makes it even more important that you have a department that looks at your operations to make sure that you're as compliant as one can be. So. And that is it, folks. Any questions or feedback that you want to provide at this time? I'm going to add you for a second there. All right, well, thank you very much. I appreciate your time.
Just before you leave, there are question cards on your table, so if maybe you weren't comfortable raising your hand and asking a question, please fill that out and turn that in to one of the MeckLINK employees around here, and we will get those questions answered and posted for you. Thank you for coming this morning.